Greet, seat, and prepare patient for procedure. Review medical and dental history. Explain procedure and answer any questions. Go over financial information, sign consent form.
Hi Dexter, today we're going to be doing a tooth colored filling on your front tooth here. Are there any changes in your medical history, new medications, anything like that? Okay, we'll get started then.
Take a shade in natural lighting. Check chart for previous shades. Transfer the mouth mirror and explorer to the doctor simultaneously so the doctor can examine the tooth. Retrieve mirror and explorer. Transfer topical anesthetic and then transfer local anesthetic. Give the patient a mouth rinse and suction with the saliva ejector. The doctor may leave the room to let the patient get numb for 5 to 10 minutes. Observe patient. Place dental dam if necessary with mouth prop. When the doctor is ready, transfer the mirror and explorer to the doctor. The doctor will check to see if the patient is numb. Retrieve the explorer, grab the HVE and air water syringe. The doctor will prep the tooth using high-speed and/or slow-speed handpieces. Assistant will use the air water syringe to keep the mouth mirror dry and rinse if necessary. Once the doctor puts down the handpiece, pass the spoon excavator to ensure all the decay is removed. Have the gauze ready so the doctor can wipe off any excess debris. Rinse and dry prep. Pass the explorer. Doctor will use the explorer to check the preparation. Transfer matrix, then wedge with cotton forceps if necessary. Then pass a cotton roll so the doctor can place it to help with isolation. Mix and pass the liner to the doctor on the carrier, calcium hydroxide only on the floor of the prep. Sit next to the patient's chin with a mixing pad and a gauze so the doctor can get more and clean off his instrument. You can mix and pass the base here if the doctor wants to. Transfer the etchant to the doctor, which is placed on floor and walls of prep. This is left on the tooth for 20 to 60 seconds, depending on the manufacturer's recommendation. Rinse and dry thoroughly. Cotton rolls may need to be changed at this time. From here on out, it is very important to keep the tooth dry until we are done curing the composite. Turn the light onto the patient's chest and pass the bond to the doctor using a dap and dish and microbrush. You may see the doctor dust the tooth with a little air to help thin out the bond material. Now it's time to cure the bond. Either the dental assistant can cure, or the dental assistant will pass the curing light to the doctor so he can cure. Then transfer the composite, either flowable or paste, with the correct shade. The doctor will place in 1 to 2 millimeter increments, curing in between. Have the composite placement instrument ready to pass. Now get the bond and gauze ready to place next to the patient's chin. The bond is used so the instrument will not stick to the instrument, and the gauze is there to wipe off any excess material. Once the doctor is done adding anatomy using burnishers, the composite instrument, or using the composite instrument, the filling is cured. Turn the light back onto the patient's oral cavity, and now it's time to remove the matrix. Pass the doctor the cotton pliers, and he will first remove the wedge, then the matrix system, and then the mouth prop, and also the dental dam if it was placed. Pass 12 to 18 inches of floss so the doctor can check the inner proximal area. Have the finishing strip ready so the doctor can smooth the inner proximal area. Give the patient a mouth rinse and dry the area worked on. Then you will pass the articulating paper holder so the doctor can check the occlusion. If the filling is high, the doctor will need to use the high-speed handpiece to adjust occlusion. Polish the filling using polishing paste and polishing cup, and then you will rinse the patient's mouth. Give post-op instructions. If anesthetic was used, explain that it may last from 2 to 4 hours. Hot and cold sensitivity is normal. If you were to try and whiten your teeth, it will not change the color of the filling. Document procedure and dismiss patient.